Hi, are you concerned about your weight? Are you concerned about developing diabetes? Well, one of the kind of current concerns or newer concerns is early onset diabetes, defined as people that develop diabetes before the age of 40. And it's really linked to increasing rates of obesity in our population. And so it's a really important subject to be aware of. Increased risk comes with being overweight, unfortunately, and that in itself causes often poorer outcomes if someone is diagnosed with having type 2 diabetes earlier in life, i.e., before 40, then the complications that come with that are often more severe. There's an increased risk of developing sort of the classical complications with diabetes, such as retinopathy, eye damage, nephropathy, kidney damage, neuropathy, nerve damage, an increased rate of heart disease, and also close links with an increased rate of endometrial cancer, that's the lining of the womb as well, and kidney cancer as well. So it's really important that if someone is concerned about being overweight, that we take steps to try and lose weight through diet and exercise, through your local GP surgery that could perhaps refer on to a weight management service in your area. But it's very important that if people are gaining weight and they're sliding into being at risk of developing type 2 diabetes, that early detection and early intervention is really important. And that can be done through blood tests through your GP surgery. So if you are concerned along these lines, please check in, get a blood test, see if you're either becoming sort of type 2 diabetic, the kind of more classical, the more common type of diabetes, get the blood test done and get some advice about how to then reverse things. Obviously, about a year ago, there was some good advice and guidelines about trying to put risk of diabetes or actual diabetes into remission through diet and weight loss. So we are getting better these days at picking up when people are pre-diabetic through a blood test called a HbA1c, which looks at what people's blood sugar has been doing over the last 3 months or so. And that can help us to diagnose pre-diabetes. So that the sooner you know about the risk of a sort of rising blood sugar, blood glucose, the sooner that you can intervene through weight loss and lifestyle change to try and avert developing type 2 diabetes earlier in life and suffering poorer consequences as a result of that. Hope that's been helpful. Just want to keep you up to date with the latest info. And until next time, thanks for listening.